So there's another very important thing that you are supposed to know or ask patients that actually come to the clinic and say that they have some abdominal pain. All right, that's a past surgical and medical history. Okay, so yeah, you are supposed to ask them, but it could be that you don't really know why you are asking them this. All right, so in this lecture we'll just break it down so that you guys will know the reason why we always ask what the past surgical history and medical history for patients that have acute abdomen. So acute abdomen, you guys already know, all right, abdominal pain. So if a patient comes to you that okay, they have abdominal pain, you might actually just want to know their past medical history and their past surgical history. It could be that the abdominal pain is as a result of a surgery complication. It could also be that the abdominal pain is as a result of a medication that they are currently taking or they took previously. All right, so let's talk about it in depth. We said that when evaluating a patient with acute abdomen, it is essential to consider their past surgical and medical history. Okay, and this is to identify potential causes of abdominal pain and also to recognize possible complications or reoccurrence. It could be that they had a surgery, so now they are having like a development of an enterocutaneous fistula, so it is now becoming painful and all that, right? And to also help you be informed on diagnostics and therapeutic decisions you are going to take. So it could be that they are having this abdominal pain as a result of a drug they are taking, so you don't use that drug again. All right, so it will help you on decision making too. So now for the relevant past surgery, you ask them about previous abdominal surgeries like appendectomy or cholecystectomy. Okay, you also ask them about gynecological surgeries like hysterectomy and cesarean section, right? Then bowel resections or anastomosis. You see, ask them, have they ever had any bowel resections, anastomosis and all that, right? Try to get all those information. For the relevant past medical history, you ask them if they have had any gastrointestinal diseases before, like inflammatory bowel disease or gastroesophageal reflux disease. You still ask them about pancreatic or biliary diseases like pancreatitis or cholecystitis. You ask them about cardiovascular diseases like myocardial infarction or heart failure. You ask them about diabetes or metabolic disorders. You ask them about previous abdominal trauma or injuries. You ask them about history of cancer or radiation therapy. You ask them about medications that can cause abdominal pain or interaction with treatments like non-steroidal anti-inflammatory drugs and anticoagulants, right? Now, considering this information, it will help you to develop a more accurate differential diagnosis. Okay, it could help you choose the diagnostic tests or imaging studies to use. It will help you select the most effective treatment strategies to use. It will help you also anticipate and manage potential complications that could develop from these surgeries. Okay, so guys, that's it about past surgical and medical history when you are trying to treat patients with acute abdomen. All right, so that's it, and see you guys pretty soon.